On the invitation of College of Physicians and Surgeons Pakistan, a delegation from United Kingdom comprising immediate past President of Royal College of Physicians London and eminent international cardiologist Dr. Sara Clarke, Dr. Sebastian Alexander, Regional Director CPSP Regional Center Birmingham and Consultant Endocrinologist Dr. Asad Rahim, along with Dr. Javed Kiani, an emergency specialist, visited Fatima Jinnah Medical University and College of Physicians and Surgeons Pakistan and King Edward Medical University. On the first day, Professor Sara Clarke chaired the seminar, The Theme of Women in Medicine from Aspiration to Achievement, organized by the Vice Chancellor of Fatima Jinnah Medical University, Professor Khalid Masood Gondal, and the faculty members of Fatima Jinnah Medical University. The seminar began with recitation of Holy Quran and National Anthem. President CPSP, Professor Muhammad Shoaib Shafi, through the video link, welcomed the delegation. Vice Chancellor Fatima Jinnah Medical University, Professor Khalid Masood Gondal, highlighted the contributions of Fatima Jinnah Medical University and the College of Physicians and Surgeons and updated the participants about postgraduate medical education in the country. Dr. Asma Ahmed from Khan University, Karachi, discussed the topic of women in medicine in Pakistan, navigating challenges and seizing opportunities. Dr. Sara Clarke gave a detailed talk on women in medicine in the UK, followed by a question and answer session. Professor Bilqis Shabir, Chairperson of Department of Medicine and Director Quality Enhancement Cell of Fatima Jinnah Medical University, delivered a lecture on Beyond the White Coat, Unmasking Female Physician Burnout. Dr. Asad Rahim, Regional Director of CPSP Regional Center Birmingham, UK, discussed male perspective on women in medicine, followed by a question and answer session. In the afternoon, there was a career counseling session and an open panel discussion on women in medicine. The panelists included Dr. Sara Clarke, Professor Khalid Masood Gondal, Dr. Asad Rahim, and Dr. Asma Ahmed. An interactive session was also held with the students of Fatima Jinnah Medical University. After the seminar, Professor Samina Ghaznavi, an eminent scholar, discussed women's rights in the workplace through an Islamic perspective. Principal of Fatima Jinnah Medical College, Professor Abdul Hamid, in his closing remarks, thanked the delegate for participating in this interactive seminar. At the end of the seminar, Vice Chancellor of Fatima Jinnah Medical University, Professor Khalid Masood Gondal, presented an honorary shield and the history book of FJMU to Dr. Sara Clarke and the participants. In the evening, the delegate participated in the dinner meeting hosted by the College of Physicians and Surgeons Pakistan at its regional center in Lahore. Eminent scholars, researchers, heads of various medical institutes, and counselors of CPSP, including Director General National Residency Program, Professor Mahmood Ayaz, Director General Medical Education, Professor Amir Zaman Khan, Director Advanced Skill Course, Professor Abrar Ashraf Ali, Council members, Professor Muhammad Tayyib, Dean and faculty members such as Professor Ghulam Mustafa Arain, Professor Kamran Khalid Khwaja, Professor Sayyid Asghar Naqi, Professor Farid Zafar, Professor Aisha Shaukat, Professor Riaz Waraich, Professor Aqib Suhail, Dr. Nawaz Rashid, and the members of faculties were also present. Senior Vice President CPSP, Professor Khalid Masood Gondal, updated the participants about the contributions of CPSP both national and international levels. Dr. Sara Clarke and other members of the delegation appreciated CPSP roles in promoting high standards and quality medical education in collaboration with renowned medical institutions across the globe. The guests and the participants had interactive session too. The dinner meeting concluded with the vote of thanks and souvenir presentation to the distinguished guests. The next day, the delegation, accompanied by Professor Khalid Masood Gondal, visited King Edward Medical University. They interacted with the heads of medical and allied specialties. Vice Chancellor of King Edward Medical University, Professor Mahmood Ayaz, welcomed the delegate. In his presentation, he highlighted the recent achievements of King Edward Medical University. The delegation also had an interactive session with the faculty and the students. Registrar, King Edward Medical University, Professor Muhammad Imran, welcomed the delegate. Dr. Sara Clarke visited various departments including Biomedical Sciences, Artificial Intelligence Department, and the Visitors Gallery. She appreciated the contributions of this prestigious institution in medical education and quality service delivery. Souvenirs were presented to the guest by the Vice Chancellor Professor Mahmood Ayaz at the end of the session. In the evening, the delegation visited the Wagah Border. They were accompanied by Senior Vice President of the College of Physicians and Surgeons, Pakistan, and the Vice Chancellor of Fatima Jinnah Medical University, Professor Khalid Masood Gondal. The delegation witnessed the enthusiastic parade of soldiers followed by the flag ceremony. The next day, delegate visited Fatima Jinnah Institute of Mother and Child Health at Sir Gangaram Hospital, Lahore. The state-of-art facilities provided at the Mother and Child Health Center were highly appreciated by them. Dr. Sara Clarke expressed her deep admiration for the services provided to the ailing humanity. She inaugurated the new neonatal intensive care unit in the pediatric department of Fatima Jinnah Medical University and interacted with postgraduate residents along with Vice Chancellor Professor Khalid Masood Gondal. She declared it as one of the best departments. The delegation's visit was covered on the national and local TV channels, and the link to these broadcasts are provided in the video description and can be viewed. The delegation also visited Lahore College for Women University led by Vice Chancellor FJMU Professor Khalid Masood Gondal. The Vice Chancellor of Lahore College for Women University Professor Uzma Qureshi welcomed the delegate along with the deans and other faculty members. The delegation interacted with the faculty members and the students. Heads of both institutes discussed innovative impact of Business Incubation Center headed by Dr. Taskeen Zahra at Fatima Jinnah Medical University. At the end of the visit, souvenirs were exchanged. In the evening, the delegation had the dinner meeting with the Honorable Minister for Specialized Healthcare and Medical Education Department, Government of Punjab, Khwaja Mohammad Salman Rafiq, senior teachers Professor Rashid Latif, Professor Akhtar Sohail Chuktai, Commandant CMH Lahore, Major General Muhammad Rafiq, and the council members of College of Physicians and Surgeons Pakistan participated in the dinner meeting and updated the Honorable Minister about CPSP international collaborations. Senior Vice President CPSP and the council members thanked the delegate and the Honorable Minister for Specialized Healthcare and Medical Education, Government of Punjab, Khwaja Mohammad Salman Rafiq, for gracing the dinner with their presence. The souvenirs were exchanged on the occasion. On the final day, the delegation visited Amiruddin Medical College and Lahore General Hospital, where they interacted with faculty members and the students. The visit concluded with an exchange of souvenirs followed by a group photo. Later on, the delegate visited Chuktai Institute of Pathology and witnessed the state-of-art facilities there. They visited various departments of Chuktai Institute of Pathology, including histopathology, microbiology, hematology, immunology, chemical pathology, and virology. Dr. Sara Clarke interacted with the residents, fellows, and the faculty members. Before the departure to the UK, the delegation had a dinner at the residency of DG National Residency Program Professor Mahmood Ayaz. The head of delegation, Dr. Sara Clarke, Regional Director UK Dr. Asad Rahim, and Dr. Sebastian Alexander on this occasion thanked the College of Physicians and Surgeons Pakistan for their invitation. Senior Vice President Professor Khalid Masood Gondal, DG NRP Professor Mahmood Ayaz, and Professor Akhtar Sohail Chuktai expressed their gratitude to Dr. Sara Clarke and other members of the delegate for visiting CPSP and their renowned educational institutions. The College of Physicians and Surgeons is following the vision of current council. Besides academics, research and infrastructure development, it is strengthening overseas collaboration. In same context, this delegation was invited. In last week of October 2024 and in the beginning of November 2024, a delegate from Royal College of Physicians, Edinburgh is also expected to visit CPSP Pakistan for collaboration between sister institutes. The past president of Royal College of Physicians, London, Dr. Sara Clarke, and Dr. Sebastian Alexander in various meetings appreciated quality of medical education and patient volume and care and hospitality by the CPSP. They expressed their feelings as
I'm Dr. Sebastian Alexander. I'm actually from the UK, Cambridge, England, and I'm a general practitioner or family doctor in Cambridge, UK. and I also work for NHS England as part of the Transformation Directorate. And I've just like to say a few words around my visits to Lahore, Pakistan, over the last few days. First of all, I'd like to express my thanks to Professor GONDAL, who's the president of CPSP and also Vice Chancellor of Fatima Jinnah Medical University, and also Dr. Assam Rahim, who's organised our visit, who's the CPSP representative in the UK. And we've had a very busy time, but it's been extremely interesting. We've started our visit at the Fatima Jinnah Medical University for females, and we attended the conference here, and we both spoke and found that extremely enlightening. And I was really impressed with the enthusiasm of all the female students here at Fatima Jinnah Medical University. We also visited King Edward's University Medical College, which was fascinating, brilliant facilities, and then also went on to visit Lahore College for Women University, and then also Gangaram Hospital for Mother and Children, which is just across the road from where I'm recording this message at the moment. Again, a marvellous new facility for women and children with all the obstetric and non-obstetric complications around childbirth and delivery and looking after neonates. I think I've been incredibly impressed by the standard of medical care, given the volume of patients that each hospital facility has been seen, and also the quality and enthusiasm of the students and the recent medical graduates and the consultants. This is not just a consultant-led service, but it seems very much led by the junior doctors and the medical students who are coming up with some tremendous ideas. As part of my role in the UK, I also look after some of the digital technologies. And again, hospitals I visited just demonstrated the progress that you're making and they're making around digital tech. We also visited a private pathology facility this morning and just was amazed by the complexity and the range of diagnostic services that were being offered at the time, and offered on a very quick turnaround, the volume of specimens going through the laboratory, and then more importantly, the state-of-the-art equipment, and the best possible equipment being used, and also the tracking of blood samples and pathology specimens was very impressive. We've also had a tremendous experience of learning about the culture and history of Pakistan. We've had the opportunity to visit Lahore Castle and some of the old town, and also some of the other sites, but we've been too busy to really experience the full beauty of the whole of Pakistan, and we've been restricted in our visit to Lahore. But it's been a fascinating visit, and I've just been impressed with the enthusiasm of all the medical team, and I'm especially impressed with the dedication, I suppose, of CPSP to ensure that women in medicine are fully represented and developed as core medical students going forwards in delivery of healthcare, and more importantly, with the care of patients and making sure the quality and in delivery of healthcare. And more importantly, Professor GONDAL and Sara for inviting us. Thank you.
Hello, my name is Dr. Sara Clarke, and I'm a consultant interventional cardiologist at the Royal Papworth Hospital in Cambridge, United Kingdom. I'm also the immediate past president of the Royal College of Physicians, London. I'm the past president of the British Cardiovascular Society as well. It's been my pleasure to come to Pakistan for this visit, and I'd like to thank Professor GONDAL, who's president of the College of Physicians and Surgeons Pakistan, and also Dr. Asad Rahim, who's a consultant in the UK, who's also the UK lead for CPSP. This visit has been a mix of education and visit to historical sites, but also clinical facilities, and in particular a private pathology facility. And particularly for someone like myself who has a background in improvement and has looked at pathways, particularly in cardiology across the UK, and looking at how we can improve patient care through amending pathways. So it's been a very useful visit for me. We visited various hospitals during our stay. We went to the King Edward's University Hospital, where I met many students and hopefully inspired them to pursue their career in medicine. Went to the Lahore College for Women and Children and opened their new neonatal unit. And there I was impressed by the scale of the the number of sheer volume of patients coming in day to day from an obstetric perspective, but also how they had redesigned the facility to follow the pathway of a woman be triaged into a more emergent care. And then the facilities that were available for the newborn, particularly the incubators, which were all lined up, they looked very state-of-the-art, and the facilities for allowing others to spend time with their babies. And also went to Lahore General Hospital, which was fascinating to meet colleagues who worked across different specialties and just understand the sheer volume of patients that attend the hospital on a day-to-day basis, and particularly in cardiology and my own specialty. And I think I was struck across the board with the enthusiasm of the physicians, their eagerness to learn and to do more for their patients, and the questions they're asking me so that we could compare care that was delivered in the UK with care delivered here in Pakistan, and the gap and how we could address that gap. And also to discuss from the CPSP point of view how junior doctors can come across to the UK and spend a 2-year fellowship, if you like, to work in our system and learn from our system, and then come back to Pakistan and bring those skills and expertise back to their own country and here working in their hospitals. I myself did a fellowship in the States for 1 year, and I learned a huge amount from a different healthcare system and was able to really transform the healthcare that I was trying to deliver back in the UK. I'd like to comment, I think, particularly on the enthusiasm and dedication of all the staff that I've met, and how proud they were to work in the hospitals they work in, how much a team they were, their eagerness to want to do more for their patients and learn from us in our visit of how we addressed issues. And I think it's an opportunity for us to collaborate and learn from each other. I've certainly learned from this trip, and I know that there's a lot that can be learned from the UK system, whether it be on further discussion, but also for people visiting, as I have, coming to the UK to see how our healthcare system works. And also looking at research. Some of the doctors that I met had undertaking research projects, and there's clearly overlap or a synergy with some of the projects that are being undertaken in the UK, and there may be opportunities for collaboration here in particular. So I think this was a taster, if you like, and I think there's a lot more that we can learn together and work forwards together to improve the healthcare, not only of patients in Pakistan, but also for patients in the UK. I've really valued the opportunity to come across to Lahore. I want to thank Professor GONDAL and Asad Rahim for this fantastic opportunity, and hope it's the beginning of a longer collaboration, both clinically and in research. Thank you for this fantastic opportunity for me to come and be in your healthcare system and meet so many people. They've gone out their way to welcome me and show me what is the healthcare system here. It's been an absolute privilege. Meeting the medical students and the junior doctors, seeing their enthusiasm, in some cases reticence, and encouraging them to keep going and pursue their dream and their careers, and to make sure they talk to each other and seek guidance and help where they can so that they can achieve their goals. And also spend time with CPSP and the wonderful work they're doing, particularly in encouraging some training in the UK, and to come back again to bring skills back to further the healthcare system here in Pakistan. I'd like to say to CPSP, Pakistan Zindabad.